Good morning. My name is Colette Nelson, and I'm here this morning with Ms. Teresa Jackson. She's given me the opportunity to interview her here for our clinical, and I'm going to allow her to introduce herself.
Hi, my name is Teresa Jackson, nurse practitioner. I'm here employed by Community Health of South Dade and the walk-in service.
Okay, Ms. Jackson, thank you so much for taking the time out. I know it's very early. I'd just like to ask you a couple of questions. For instance, I know this is an urgent care facility, and a lot of times to diagnose patients, you have to do a lab report, which helps you to make the decision as to what's going on with the patient. How quickly is the turnover time for the labs?
What we do is I will order, say for example, a PT INR, and I need that stat. So we I electronically send it over to the laboratory. And the turnover time is about 30 minutes if I write a stat order.
Okay.
And I get my results then.
Great. Okay. The other thing is sometimes we know patients come in with ailments that has to do with either bones or fractures. Is there a radiology department here?
Temporarily, our radiology department is closed. They're down. They're renovating. But we have a facility at our other campus in Homestead, and what we do, we go ahead and make appointments over there, and they do their x-rays.
Okay. Great that you mentioned there's another facility. I wanted to ask you, I know that the system has now turned over into electronic. Some institutions use electronic and paper, which is called a hybrid. Is this facility in the hybrid stage, or it's totally electronic?
Electronic. We're paperless.
You're paperless. Okay. Do you find at the time when you made the conversion you had difficulties retrieving patients' records?
No, we didn't have any problems. Everything converted over from Omnidot, and now we're doing Entergy, the SAGE system, and it's absolutely wonderful.
Did your colleagues, other doctors, have problems working the computer system?
No, we had thorough training for several weeks, doing the different systems, different electronic orientation. So they really had a great training session there for us.
Great, wonderful.
And was able to transition over.
Well, that's great to hear that, because we know we have to be doing that's the new way in where medical technology is going in records. So when you see the patients, do you have what is called a tablet? Do you come to a regular PC? I can see from this room that there's a station PC here.
Yes.
How do you document?
We have our laptops, our own personal laptops, and we carry them. They're very small. I didn't bring it in, but there is in the office. And we go in and out with our laptops. If any problems, usually the PCTs, the nursing assistants, use the desktops, and they put in all the vital signs and everything. And we have everything in our laptop, and we go from room to room with our laptop.
Okay.
Seeing patients.
So one last question I wanted to ask you. If you went to another facility like you mentioned, would you be able to retrieve a patient's record who probably would have seen you here but then decided to follow you with another center? Would you have difficulties retrieving that record?
No, it's all one system.
Okay.
Yeah, it's all one system. We're all on the same network.
Great. So how do you like the electronic system versus paper?
Oh, it's very easy. We can retrieve lab results there, different documents that's been scanned and imaging from Jackson Memorial Hospital. It's great. It's great. Instead of going through paper, some part of the chart may be missing, but everything is in one system.
Great.
And I love it.
And do you practice at other outside facilities like you mentioned, Jackson? Do you practice there?
No,
or
I'm solely here.
You're just solely here.
Mm-hmm.
Well, thank you so much, Ms. Jackson. It sounds like you enjoyed. One more question. Your background in terms of your education, what is your degree for being a nurse practitioner?
Well, I first started out as an LPN in '92.
Oh, great.
Okay, and then I went ahead and got my associate's degree in science at the at Miami-Dade Community College, and then I went to FIU to get my bachelor's, and then I graduated from University of Miami in '99 with my master's degree in nurse practitioner.
Okay.
And I've been employed here at CHI since 2000. Yeah, and I worked here for 8 years in the West Perrine Clinic.
Okay.
Yeah, as a solo provider there, and I left 2 years and came back.
All right. So here we have it, Miss Jackson, nurse practitioner, who's working at CHI. She's wonderful. I see her interact with patients. And of course, she's an alumni of Miami-Dade. So Miami-Dade, you go. Thank you very much.
Thank you.
All right.